The study was This study was one of a kind. I had studied conditioning and stimuli in detail, but I had not truly considered its potential impact on the studies it may bring forward. This assignment was educational, and I have identified two primary points of relevance that are supported within this study's findings. Healthcare workers have witnessed an epidemic of overdoses outside of the healthcare settings from the empirical prescription habits of opioids, but this is more focused on morphine and its uses. First, the use of a drug in unusual locations is vital to the potential overdose or intoxicated behaviors that may influence one's death. Additionally, it is vital that an addict be informed that if they return to the use of the addicted products, their tolerance is greatly different than when they used their preferred drug. Hence, adjusting the dosage to a lower level is vital to their survival. An individual was autopsied and investigated with the use of morphine concentrations in the blood and collected clinical data. The evaluations identified heroin use of the young man that caused his death. Although the individual had been treated on many occasions, the accustomed use within a strange surrounding atmosphere caused his fatal complexities and death. The conditioned tolerance failed to operate. The concentration of the morphine in the blood was not exceeded by the measured levels in previous treatment records. The concluding results identified a pathway of data in literature indicating the morphine concentration measured in drug-related death cases failed to differ significantly from those non-fatal measured in cases. Great stresses on prevention interventions from harm reduction caused a formulation of data-related aspects that surrounded drug-related deaths. Mechanisms linked to drug-related deaths are numerous. One variant is wherever the active substance is subject to availability on the black market, which contrasts from the acclaimed levels. More often, an addict is in treatment will tolerate the abstinence for any amount of time, but will assume the next use can be the same as when they started to quit using. For example, if the individual used 4 doses when they quit using and maintained a year of sobriety, when the individual returns to the product using the 4 doses, it is often to be an overdose death. The use of substance in mix with increased dangers of fatal overdosing. The findings identified situation-specific tolerances where the prevention of fatal consequences of an opiated fatal measured overdose. The test rats were given large doses of morphine after morphine dosing in an atmosphere different from the environment where previously experiences of morphine had been used. The overdose rapidly appeared, and some rats did pass away, whereas the rats were given the morphine dose in the same circumstances. The same dose size had a substantially smaller effect, since the substance was given in the usual environment, and so the expected behaviors were in effect. The 10 heroin overdose survivors were interviewed to discover whether the overdoses happened following original pre-drug signals. There are 7 overdoses where the drug was dispensed in a situation not formally correlated with the uses of the drugs. The conditioned resistance phenomenon is detoxicated heroin in detoxicated heroin addicts within a double-blind circumstance on 4 occasions. One of the circumstances was subjects were disposed a moderate dose of hydromorphine in an infusion, minus telling them when or what was being given. Another occasion, they injected the same dose themselves, in which the same process was completed with salt. Although the users indicated measurably greater physiologically responses after the complete effect of the drug than when previously informed. The preparation and anticipation of having the product prompt is effect contrary to the drug's effect in the person's state, showing tolerance, obviously. As a conditioned stimuli, the anticipation preceding the dispense of the opioid, reducing the reaction of the drug and participants in the advancement of devices related to forbearance. The 76 interviewed heroin addicts were admitted to the university's hospital emergency room. There were 54 overdoses from heroin and 22 seeking emergency medical care for unrelated conditions. The interviews revealed that self-administered intravenous heroin use was used within 1 hour or less before emergency room admissions. Hence, all the patients had used heroin, but did not suffer from the overdose while within the usual environment. The overdoses were used in unusual settings. The primary attributes of this study is that it is one of the first where death could be clearly related to the Pavlovian the condition. Pavlovian condition, yeah. The concluded details of fatal consequences of heroin may have stayed due to inability of movement of conditioned tolerances. The conditioned location preferences results from the users taking a larger dose each time to accomplish the identical impact, as the client is not having the opportunity of secondary conditioning with stimuli, as he or she continually modifies the location in which the drug was administered. Hence, the usage within unusual or strange environments, the conditioned buildup of tolerance will not function, since the body is not anticipating the dose. The ending results are otherwise accustomed measures of product leading to an overdose, and thus the diseased state. Again, the misleading term overdose relates to a quantity no greater than any other doses administered and consumed without fatal conditions. All in all, the concentration of morphine found in the blood were well below the values issued in the fatal doses, as the conditions of the users and the locations were key investigations of the issue identified within most of the study. The phenomenon of conditioning overdose deaths is vital for human reduction. Uses related to the concept of conditioned locations preferences would have a greater chance of survival than those who are not informed of it. Educational programs are vital in treatment, especially in the treatment disclosure of the risks and nature of conditioning. The role played within conditioning cues within drug action and relapse, the greater chance they will avoid deadly complexities. The closing validation in proven that the closing validation is proven that environmental locations are critical to a user's survival habits. If an addict returns to the use of products, the dosage must be lowered as the tolerance within the addict has changed. Sobriety is a goal. Relapse are often unplanned, and the conditions of a withdrawal are symptomatic. Addiction is a disease, and relapses are withdrawals of past addiction. The dosages matter as much as the locations in which the products are used. This case report on the provolone conditioning and risk factors of heroin overdose deaths was very educational. I also utilized a website that offered details about addiction being a disease. And lastly, another case study associated with opioid overdosing. These resources were very educational. However, the primary case study was what I learned the most from, and those key factors still surround making sure that an addict knows that if they go back to use, they must lower their dose, and that the environment in which an addict uses their drugs can be life or death in the making.